Your health is the most important thing you can invest in. Hey guys, this is Dr. Brendan Cochran. Hope you're having a fantastic day. Interactive Health Clinic. We're going to talk more about what is going on out there. What craziness is going on. So, first off, we're going to start with some interesting things economically and more bailouts, meaning people that are getting bailed out that don't need to be bailed out, still happening. People that are being very successful during this episode are getting money and investing it in other ways that they don't need to be investing it. So people are getting richer that shouldn't be getting richer during this state. Here's a prime example of that where hospitals are getting bailouts and furloughing tons of workers. And guess who's getting rich? Not the nurses, not the doctors, but the administrators are taking all the funds and stashing it. So it's just crooked that we keep going down this pathway of basically, screwing you over so that the rich can get richer and then you have to pay the taxes for this later. It's just sickening. All right, so that's my little soapbox on the economy, going off on that. Now, I have to address one thing again, and the reason I have to bring this up is literally it's so bad when you hear the World Health Organization saying one day that asymptomatic people do not spread the virus or are very poor at spreading this specific virus. And then guess what? You see 2 days later, they retract that and say, oh, well, that wasn't entirely correct. And we know that this isn't correct because this is a honey badger virus. Literally what it does is it sneaks around you and gets to you when you least expect it, when you let your guard down. How do you think it got out of China? How do you think it keeps getting around people? We know that people are asymptomatic and they can spread this thing. Now, what does that mean though? Again, it encompasses the viral load and how long you're around people. So when we look at this, we need to understand that if you're in contact with a person without any mask or protective gear, or the other person's not wearing a mask, remember, so they don't spread it to other people, time does matter. So if you're exposed without protective equipment and you're in close proximity to somebody, indoors, not outdoors, you're getting a larger viral load, and more viral load means more likely that it's going to actually get inside you and start replicating and you get infected. So what does that look like? Well, you might be in the car with, say, somebody where it's enclosed air, and it may take as little as 10 minutes for you to be then infected if you're around somebody. Versus, say, if you were wearing a mask in the car and somebody else was not wearing a mask, and that mask helps reduce some of the matter, but still some of that gets through, and it depends on the type of material you use. So like N95s, or we talked about those homemade shop towels that have like a 93% filtration, you still have 5 to 7%. If you get down to the cloth or these bandanas, much lower. It's more like 20 or less percent that you're actually protecting yourself. Mainly it's protecting you from excreting your droplets onto somebody else. So what do we look at then? Then we actually see that maybe you extend your time frame up to 20 or 30 minutes being around that person, and then you actually get the infection. Why? Because your viral load and your exposure time has increased. So we are learning that. We do know that has a profound amount. That's why when you're outdoors, the chances of you getting it when you're outdoors with somebody else that's outdoors, especially if you're not like on top of each other, is very low compared to if you're indoors. It's much higher because you have air circulating with your HVAC systems, AC units. It's a closed, confined space. You don't have sun hitting it, deactivating the viral droplets. So that's why it's especially important to wear a mask when you're going outdoors. Now, for all those of you that have people that are still naysayers about the masks or kind of running away from that, distancing and eye protection to prevent that. I'm going to share with you a published study just recently in the Lancet. Yes, I remember I talked about the Lancet before, and they got into hot water with publishing some pretty crappy science about hydroxychloroquine that they had to retract. So they are now publishing this. Hopefully, it looks like a much stronger argument, of course, than the hydroxychloroquine study. So you know me, once the journal makes a crappy report, like the Lancet, like New England Journal of Medicine, like a bunch of these, quote, science-rich journals, my level of faith in them goes down. So, of course, we can take this with a grain of salt, but I do reiterate and find this is extremely important in your decision making. Another interesting thing that we know, so we analyzed some of our Navy, right? So we looked at the USS Theodore Roosevelt, and we looked at the infection that went around there. And what was found is 1 out of every 5 people were asymptomatic, right? They had no signs and symptoms, but they were actually infectious with the virus. So just imagine roughly what we know is it's probably around 1 in 5 people can be an asymptomatic person, that they have no signs and symptoms of this and are actively spreading this to you as possible. So we know that takes off the more we open up the economy, which is a good thing, but the more of us that don't practice measures like masks and distance or basic hygiene stuff, the more this is going to continue to thrive. Now, we do know that, remember, you are more susceptible if you're over the age of 50 and you have pre-existing conditions, or you're under the age of 50 and you're overweight or you have pre-existing conditions as well. So it tends to target those people higher when it comes to mortality rate. However, long-term consequences, I don't want to find out. We still have people that now we've been in this, since China announced it 6 months. There's reports of people that have not regained their smell back. They have permanent loss of smell. So we have permanent symptoms that are going on with people that survive. So you really don't want to risk trying to get this because we just don't know why it affects one person more than the other. The one thing we do know, 100% certainty, is if you have those pre-existing conditions, you are in a lot more vulnerable situation. Now, another disturbing thing that's coming out, so this was published just recently. We have a professor overseas that actually pretty well recognized and looked at what's going on in England specifically, and he said there's a claim, at least that he's talking about, that only 10% of patients with this coronavirus develop antibodies. Meaning, if that's true, that's a big problem, right? That means that only 10% of the population can develop antibodies from this. So that means that you can get it over and over and over again. And that would be our worst fear, because that's what happens currently with the cold virus, right? And some other viruses. We can get them over and over and over again because we don't mount antibodies. Now, even if we do mount antibodies, you have to mount the correct antibodies to have immunity. And we don't know if that's possible as well. So this is a blow to us, and I'm going to be watching this very, very closely because we need to learn more and more about this. But this is concerning information, especially concerning if you're banking on the vaccine saving you. Remember, if we look back in history, the fastest vaccine we've got out that was safe was basically the mumps. We did that in 4 years. So if you're looking at something being developed and pushed out, that's the fastest one we have thus far. So it's going to be a while, guys. I don't see anything happening very soon for this thing to go away anytime soon. So those are all very, very concerning things. Obviously, more people are coming out. We're seeing spikes in cases in Arizona, Utah, and many other states. It continues to grow with these protests and basically social unrest. And I get it. People are angry, especially when you see everything going on in the nation and you see that we're literally shifting the curve to making the rich, making the people who are middle class or poor poor. We've learned that lesson. It doesn't work, right? We learned that way back in history. That's a very poor solution. So we got a lot of politics, a lot of stuff going on, creating all these protests. This is, of course, putting people closer together. And it is creating this fear because we are seeing the numbers jump up, and we are seeing some of the death rates start to climb as well again. So when is the second wave? Well, right now we have a steady incline. Best situation is we continue to see just a mild incline or a flat plateau as we progress through the summer. And that could definitely happen because we know that a lot of places around the world that are warm and hot right now are having rapid climbs. Brazil is a great example of that. Mexico is another example of that, where it's just not a seasonal thing. So we have more of a plateau. That would be the ideal situation. However, the biggest fear is that this thing actually calms down a little bit, hits a lull, and then takes off like wildfire. And that's what happened in the 1918 Spanish flu. And remember, that was because we had a lot of the military, we had a war going on, right? So a lot of the military was out and getting exposed to people. Well, right now we're kind of in our own little war in our country with everybody protesting. So then that put out this where University of Washington actually did say that they are expecting a second wave to kick in. They're expecting that in September, but it to happen at least by the end of October. And the predictions currently are, worst case scenario before this is all said and done, in the US between 800,000 and 1.6 million deaths. That's not a fun number to have. Now, most of the people that are in trouble are the ones that have pre-existing health concerns. Thus, the reason why you really, really, really need to make your health a priority right now, right? That has to be priority number one. Your finances should be going into improving your health and working with somebody who's really, really good at doing that right now, because you have to do that, guys, because if you get this thing and you're not prepared for it, it's going to roll over you harder than if you are prepared for it. All right. So at least we can add that edge to it. Now, what else is out there that could potentially be helpful for this? I've talked about several different things if you've tuned in or watched some of my videos. Well, here's another one. This was very interesting. This was actually looking at bee venom therapy and assisting in the treatment of this. This study did come out of China, and it's a study that needs further developments. But it's interesting that we're looking at this because it's not too crazy. We actually have doctors that specialize and use bee venom therapy in people with immune deficiencies, people with autoimmune diseases. Currently, it is a medical treatment for other conditions as a supportive treatment in those specific issues. So it's not totally off the rocker to think about this. Bee venom therapy has actually been around for quite a bit of time. So this is another promising thing to add to the arsenal. Now, there's so many things that I've told you so far. This would just be one little piece that we could look at. Definitely focus on those other things. You really need to make sure you're doing your core arsenal. Be active, be eating healthy, rich foods, be losing weight right now. If you are overweight, that should be a focus. You should be on those core supplements that we talked about. And if you haven't done that yet, download our handout on our website. It gives you at least a start of what we think is important, not only in this virus, but any virus, as a piece of improving immune function and creating health in people. All right. And that's all we're about. We're not about treating the disease. We're about how do we make you stronger? How is your terrain stronger so that you can handle anything that's thrown at you? All right, guys. Good talking with you again. This is Dr. Brendan Cochran. Please share it, like it, and we will talk to you soon. this is another really good incentive to invest in your health. Investing in your health is the best thing you could ever invest in.